Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Chronic pancreatitis, we are looking at the Rosemont's criteria for the diagnosing it. So first, let's look at the major criteria. So under major criteria, there are two factors, that is the pancreatic features, parenchymal, as well as the ductal features. Now let's look at the parenchymal features. So under major criteria, the parenchymal, it includes the major A criteria. So what is included in major A? So major A criteria, it includes the hyperechoic foci. There is a hyperechoic foci. So there is a hyperechoic foci, and this is with the post-acoustic shadowing. There's a post-acoustic shadowing. Then we look at the major B. So major B, it includes honeycomb lobularity. There is honeycomb lobularity. So this was about the parenchymal features of the major criteria. Next we move on to the minor criteria. So what does the minor criteria contain? So looking at the minor criteria of the parenchymal features, there may be presence of the hyperechoic. So there may be hyperechoic, and this is non-shadowing. Hyperechoic non-shadow. So it is hyperechoic non-shadowing foci. So hyperechoic non-shadowing foci, and this is nothing but greater than 3 mm, and this is in terms of the length and the width. This is in terms of the length and the width. Next, it also includes the lobularity. There is presence of lobularity, and this includes 3 or more non-contiguous lobules. So this includes 3 or more non-contiguous. So this is non-contiguous lobules, and this is present in the body or the tail. This is present in the body, or you can tell the tail. Then comes the presence of the pancreatic cyst. There is a pancreatic cyst. So this pancreatic cyst is greater than or equal to 2 mm, and this is in the short axis, present in the short axis, and at least 3 strands, and at least 3 strands. So this includes the strands. They are defined as the hyperechoic lines. They are hyperechoic lines. So the strands are hyperechoic lines, and they are greater than or equal to 3 mm, and this is in the terms of the length, and they are seen in at least 2 different directions. So they are seen in 2 different directions, and they are present in the body or the tail of the pancreas. In the body or the tail of the pancreas. Now let's look at the major criteria, and this time we are focusing on the ductal features. So under the major criteria, the ductal features. So here we look at there is a major A criteria. So under this, there is a main pancreatic duct calculi. There is a main pancreatic duct calculi. Now let's look at the minor criteria. So in terms of minor criteria, this is nothing but includes the ductal features. So under the ductal features, there is the irregular main pancreatic duct. So there is presence of the irregular irregular main pancreatic duct. So there's irregular main pancreatic duct. So that is nothing but the MPD contour. Then there may be the dilated side branches. So by side branches, they are nothing but greater than equal to 3 tubular anechoic structures, and each one is greater than each one. So each one is greater than equal to 1 mm of width. They are greater than equal to 1 mm of width and budding from the MPD and budding from MPD. Next is the main pancreatic duct. So here the main pancreatic duct dilation. So here this is nothing but greater than equal to 3.5 mm, and they are present in the body, or greater than equal to 1.5 mm, and this is nothing but in the tail. Now we move on to the hyperechoic MPD. Hyperechoic MPD margins. So this is nothing but greater than 50%, and this is of the main pancreatic duct, main PD pancreatic duct, and this will be in the body as well as on the tail. This will be on the body as well as on the tail. Now we have seen the major and minor criteria. Now let's look at the diagnosing them. So how do you exactly diagnose? So diagnosing of the chronic pancreatitis. So first heading will be the consistent with the chronic pancreatitis. So consistent with the chronic pancreatitis. That is, it includes one major A. So it includes one major A criterion plus greater than equal to 3 minor criteria. Next is, it includes one major A criterion plus major B criterion. And the third one is two major A criteria. Two major A criteria. Next, we look at what is suggestive of the chronic pancreatitis. First one was consistent with chronic pancreatitis. Next is suggestive of the chronic pancreatitis. So here this requires an imaging for confirmation. So it requires a imaging, and there it includes the one major A. So there is one major A criterion plus minus 3 minor criterion. Next is one major B criterion plus greater than equal to 3 minor criterion. Lastly, it is greater than equal to 5 minor criterion. Next, let's look at the indeterminate. So indeterminate for the chronic pancreatitis. So this basically requires the imaging for the confirmation. So it requires imaging. It includes the 3 to 4 minor criterion. 3 to 4 minor criterion. So minor criteria, and this is in absence of the major criteria. This is in absence of the major criteria. Next is it includes the major B criteria. So major B criterion plus minus less than the minor criterion. And lastly, in terms of normal, it includes less than 3 minor criteria. To learn and grow daily like this, please do subscribe.